Evening, all of you. It's a very nice welcome to you all to this conversation with Dr. RAJAM IYER and Dr. Sujata NAIK, and we're here to talk about living beyond 2020 and living anew. I am Gayathri Thakoor, and I'm very happy to introduce our speakers today. We have with us Dr. Sujata NAIK, a practicing homeopath who has been in this field for over 32 years. She's known for her oratory skills and for the work that she's been showing in the international forums, at conferences, and the papers that have been published. We also have Dr. RAJAM IYER, a practicing pulmonologist and a palliative care specialist. She has over 25 years of experience working with the Hinduja Hospital and Bhatia Hospital and has many stories to tell. Welcome. Thank you very much.
Thank you, Gayathri.
Thank you, Gayathri.
Lovely to be here.
Thank you.
Very nice.
Absolutely. Thank you. So, to introduce what we are going to talk about today, we know that a lot has been spoken about COVID-19. A lot has been spoken about the current pandemic, about what India has been going through over the past 4 months. I would like to start with a little bit of a memory that I had in January this year when I'd been talking to an academician from Singapore. And he asked me this stray question. Actually, it wasn't a stray question. He asked me, the East is really battling with this pandemic. How prepared is India? I was clueless. This was January. I was clueless. Past 4 months, you both have much more to tell. As a part of the women fraternity, which has been up there in the forefront, fighting this, advising people on what best to do. Now is the time when we are looking at a different 2020. We are talking of, 2020 started with a bang. We thought it would be that year of sorts. Well, it has. What do we do now? This is a new normal. We've been reading about it. What is so normal? What is so newly normal? And why is it that living anew is so relevant? Dr. Sujata, would you define what living anew here would be?
Hi, Gayathri. It's wonderful to be with you and Rajam on the same platform. And welcome, everybody. Welcome aboard. We have been talking about 2020 has been only about one thing. We all know that. And it's about COVID-19. And how our life revolves around this virus and what a virus it has been, what a year it has been. 7 months on to 2020 and we are still battling, we are still groping with the uncertainties, the challenges that this virus has thrown at us. While epidemiologists and infectious disease specialists and virologists are finding out ways and means to tackle this microorganism, life has changed for every being on this planet. Every single human being has been affected in some way or the other. For some, it has been a complete 360-degree turn. For some, it has been, their lives have been changed negatively forever. For some, it has been mild. For some, it has been moderate. So we are all in the same storm, as they say, but not in the same boat. But definitely, we are all facing 2020 as the year of COVID-19. And I would say that it has thrown up a lot of new things. Basically, our perspective of looking at life, of looking towards health, relationships, and about priorities in life have changed completely. So I think it's, to put it in a nutshell, I would say that it is all whittled down to the basics. So the frills in life have been completely cut off, have been eliminated, so as to say. And everything that is bare essential has survived. Everything that is bare essential, that is necessary, has remained. And we are also, whether it is about healthcare, whether it is about our lifestyle, mode of living, about our communication, everything is now down to bare necessities. And this is what we have to live with in the new normal. And while some of it has been a little difficult to deal with, a lot of it also has been good and optimistic. And how it really will come to that. But this is the new normal and we have to be equipped ourselves to deal with this, and this is how it is going to be. So it's not just about getting done with the virus, it is also about having to live with the virus, having to live with this truth that it is not going away anywhere, not so soon anyways. So this is what is going to be the new normal for us henceforth.
Oh, Sure, I completely understand. Dr. Rajam, would you have another definition to this? Another?
So taking the cue from where Dr. Sujata left, I think like she mentioned, the virus has really got us into sharp focus on a lot of things we took for granted till 2019. But the other thing, as a palliative care specialist, I also think the virus has brought into focus about the way we talk of death and dying, and the way we need to think about death and dying, as well as the fact that we need to focus on how there's been a collective grief, and this collective grief that the whole world is going through, and it's the world to its knees. That is something that this virus has thrown into, and we need to see how we can support each other during this whole process of healing and going through the pandemic. It's going to be something between human beings, between doctors and patients, between neighbors, between domestic help, drivers. So I think we have to learn this whole new thing of compassion, empathy, kindness, because that's where I think somewhere have lost it till 2019, so focused on your own personal development. I think that's where the sharp focus of this pandemic has come to what we can do for each other, how we can support each other at all levels, physical, emotional, psychological, financial. And that's where I feel, as a palliative care specialist, my role is become extremely important during and after the pandemic, for support, compassion and empathy, and to discuss how we can cope with and discuss death and dying much easily. Though everybody thinks it's morbid, I think we can have a nice angle to it, which we will talk about it later in today.
Absolutely. Thank you for that. Thank you for defining what you both think living anew is. Before I move to the next question, I request all the participants on this call to please put yourselves on mute. It will really help, because there's a lot of disturbance and we are not able to hear each other. So thank you for that, please. Please put yourselves on mute, and that will help go through this, because this is being streamed live to all, and we really want everyone to catch every moment of this happy conversation. Thank you to the two of you, because you defined living anew. Yes. How relevant is, yes, like we said, a lot has been discussed. What makes this second half of 2020 so relevant to be living anew? We are not even going to 2021. What is this second half of 2020? What is it that we need to keep in mind before we move on to the other questions? I'd like you to throw light on this second half of 2020, how relevant it is and how important it is for 2020 to actually come back to what you want it to be. Dr. Sujata.
Yes, Gayathri, as I said, is that now it's going to this pandemic that we are still going through. We have not seen the end of it as yet. And just perhaps that there is some light at the end of the tunnel. Perhaps the virulence is coming down, the mortality is slightly lower now. So it's just a little bit of a hopeful note there. But definitely the 2020 is probably, as they say, washed out in terms of socio-economic issues. Having said that, I think we need to start rebuilding, restructuring and revival. That should be the focus of the remaining part of 2020 and perhaps well into 2021. But as you said, let's not talk about 21 just as yet. We have about 4 months to go, 5 months to go before we end 2020. And what began as on a very horrendous note should begin on a more should end on a very hopeful note. So this is the time to rebuild our defenses, to rebuild our immunities, to prioritize on. I think health should be our main priority. And what we used to think was courageous, like going out, doing stuff, stretching ourselves to the limits, unlimited greed, unlimited ambition, no longer is going to be the done thing. What is important is to focus on yourself, to focus on your own health, your family's health and your community health. It's not selfish to look after yourself, as we've seen, because those who can help themselves are going to be able to help the community. So health first, and then the remaining should be the focus of the remaining part of 2020.
Okay, thank you for that. Thank you for that, Dr. Rajam.
So I think the way ahead would be like, to be honest with you, the virus, like Dr. Sujata said, is here to stay. And I think collectively as a society, we need to be responsible to, like I said, like earlier I said, supportive, but even to look after each other by being responsible, by keeping physical distancing. I think social distancing is a misnomer. Because I think you should still stay connected. For example, such a beautiful platform like this wouldn't have happened if it was not for the pandemic. So the fact that you're reaching out to people from far, your birthday parties are having your cousins from America and Australia at the same time. You're meeting friends probably more often I know it's a virtual meeting, but I think we need to take something positive from this, that people are making an attempt to be in touch. Also because we're looking after each other by staying away from each other. So I think we all need to be socially responsible. We need to think where our actions will lead. This virus is going to be here, is here to stay. So I think we need to be very clear about the fact that even if we develop a vaccine or a treatment, we really need to be safe. So I think it has kind of changed for good. The wearing of masks, the hand hygiene, avoiding the crowds, etc. So that's going to be here to stay. And I think the earlier we try to accept it and in our stride, probably we can make our lives revolve around it. And we need to therefore chronicle what we did till 2019 in our memories and probably share it with our children and grandchildren. And therefore, maybe it's now that we're in the thick of it, it seems dull and gloomy. But I think maybe this is going to be way of life for some time. So we need to make the most of it. And this wouldn't have happened. I wouldn't have met so many people on the platform to hear me out if it was not for the pandemic. So I think there are some things obviously we need to take from this pandemic, and we really need to be responsible collectively and not be socially distant, but we need to be physically distant from people and be connected to everybody.
Got it. Thank you. That was well said. Thank you. Dr. Rajam, before we continue, we've been told that there are some technical glitches. This conversation is being telecast live on Facebook, and we've been asked to pause a little. So whoever's listening to this conversation, please hold, because there is some technical glitch that the team of doctors at Dr. Sujata Naik's clinic is very, very, sincerely trying and sorting. Thank you for that, doctors. Thank you for helping us out. We'll wait until you let us know when to get started again. Please hold. We are going to be continuing. Give us a few moments to kind of rectify whatever it is the glitch is. Thank you.
Hello. Yeah, I request everyone to please keep their audios and videos on off. And yes, ma'am, we can start with the session. Sorry for the error.
Yes.
Thank you. Thank you all. Thank you to the doctors at Dr. Sujata Naik's clinic for making sure that we cleared those glitches successfully. And we are live again. We hope that you can hear us all. For those who are participating in this call, in this Zoom call who are there, we request you to please put your connections on mute because it is kind of, the disturbance is getting carried and our speakers may not be able to hear themselves well, and you may not be able to hear them too. So that's a request. I hope you can please put yourselves on mute. Okay, so we are looking at, we have spoken about living anew, and you have very kindly, both of you, Dr. Rajam and Sujata, have thrown light on what is so different about this second part of our 2020, and what is it that takes us to assume that we need to now start living anew. At this point, we tend to think of the ways that have been, the times that have been, and the kind of issues that have stayed or have started, let me not say stayed, have started looming over time. I'm specifically talking of psychosocial issues here, which have been, kind of worrying patients, caregivers, doctors, the police, municipal workers, and of course the observing population. Dr. Rajam, how do you think, what are your thoughts here about the psychosocial issues that have been grappling most people today?
So I think that's a very important question, Gayatri, especially in a country where mental health and psychological health is not even given that much importance, even in the educated society. And this pandemic has actually thrown this into so much of a sharp focus that it affects everybody alike. It's been a leveler of sorts, from the rich to the poor to the employed to the unemployed. And I think the illness itself has been such a lonely experience for the patients because they're in isolation, the family is in quarantine. So the sharing of grief or the last rites, all this has been affected. So I think it has been a kind of a leveler for everybody, and especially so the healthcare sector. We've had lots of this burnout by the healthcare physicians, and somewhere people, it's saddening to see that people don't seem to respect that. Even doctors and nurses are first humans to start with, and it's extremely difficult in a duty or in a shift to keep filling out death certificates and then keep yourself motivated to go back and save a life. So I think this it is impacted in a big way in treating patients, in keeping people safe, in educating people, as well as people and families who have gone through it. So it is going to be a big fallout of the pandemic that we are going to see more and more people deeply affected and deeply scarred, almost like a post-traumatic stress disorder, like a war or a terrorist attack. Also survivors of the pandemic, those who have been in ICU 2 weeks, 3 weeks, they are going to come back emotionally scarred, and therefore we need to be there for them. Also, another thing that palliative care does is to support patients and family across this very, very difficult journey.
Right. Thank you for that. Dr. Sujata, how do you think this should be addressed? How do you think it should be addressed?
Very true, as Dr. Rajam has thrown light on what a difficult time that we may be facing, not just through the pandemic, but even post the pandemic. So as the people who actually live to tell the tale are probably going to be facing an issue just like they would had they survived the war or the Holocaust. So it's going to be that grim, and the fallouts of which are still not very clear as of yet. But the stories that come in, the kind of patients that we are getting, the kind of issues that people are facing now, primarily I would say is about the memory of the event. Like, for example, if a loved one or a closed one is in the hospital, isolated, quarantined, there is no help, neighbors who are all revealing all over the place, giving you free advice, run away from you when you're tested COVID positive. There's nobody to make a cup of tea for you. Everybody gives health advice, but if there is nobody to help somebody who's suffering from COVID and who's quarantined, who's feeling weak and frustrated and tired, there's no actual help. So I think it's a time where we need to rebuild that. We have to rebuild the society, bring back the psychological confidence that people have lost through this. So whether you have suffered from COVID or not, whether you're or whether you have been a COVID suspect or you've just been on the spectrum, because each one of us, as Dr. Rajam just mentioned, that whether you live in a high-rise or a slum, whether you're in Europe, US, or in India, each one of us is vulnerable to this virus. And the thought is constantly looming over our head. The sword is constantly hanging on our head. That will I be the next one? And if I have suffered, then how do I now bring life back to semblance? Will I be suffering from after effects of COVID later? Are my lungs going to be weak forever? So these are some of the problems that people may face. And the fallout of this is generally anxiety, neurosis. Some people suffer from insomnia, loss of appetite, increased appetite, complete loss of energy, loss of motivation, loss of focus. These are some of the issues that may crop up in times to come. And as you said, that this is a condition called as PTSD, post-traumatic stress disorder. And this is something we have to grapple with and we need to be prepared with. So when you asked me about what about the remaining part of 2020, I think a lot of our energy and our resources are going to be focused towards facing this issue.
Okay, yeah, absolutely. I mean, well said. You, in fact, answered the second part of my question, where I said, how can this be really addressed? Dr. Rajam, how do you think this should be addressed? I mean, what is it that people should do about?
So I think first thing is to accept the fact that it is going to be there. I think we are so focused on treating the physical part and containing the virus and isolating the infected and doing the contact tracing and busy listening to the news of so many COVID deaths and so many COVID cases. This is going to rise because the virus is going nowhere. I think we all need to sit back and realize the after effects that this virus is going to leave and acknowledge the fact that we will face these mental issues, especially for support the families who have lost their dear ones. There are cases where people have walked into hospital and never seen them again. They've not got a closure because they've not participated in the last, or there are entire families who are quarantined, and then obviously there's nobody who is, or children who have not been able to attend the funerals or even see their loved elderlies who's been in hospitals because of the complete shutdown of international travel. So this is, I think, the biggest way to address first is to acknowledge that it's going to be there, and also request to all the doctors and all the healthcare workers and professionals, be it nurses, etc., to identify these people and support them with counselors and psychologists, including palliative care physicians or family physicians. They are the backbone of our healthcare, and unfortunately in India, when we do not have a universal healthcare, like a blanket healthcare like in England and some of the European countries, we need to rise to the occasion because there's so much fear and panic even among doctors to see their patients. But I do not think a teleconsulting, picking up the phone, sending a message to your, your one of your patients has lost somebody, just see to it that they are fine. Keep connected. Like I said before, physical distancing is fine, but socially you must remain connected. And these are the small things. I think each one of us in society needs to do our bit to see to it that the next person who has been affected, and actually it's not just infected, it's all of us who are affected by the pandemic. We need to be in touch and we need to offer support that we are here in together, and hopefully also tide over this, and there will be a day where we can say hum honge kamyab. But I think mental health is as important as physical health, and this is exactly the definition also from WHO about how the definition of health is not just absence of a disease, but it is when a person has a social, mental, psychological, spiritual well-being, and that is a holistic approach we need to adopt. But I think that's very, very important.
Right. I mean, absolutely. Very well said, Dr. Rajam. I mean, when you speak of being affected, not just infected, that is aptly, very, very aptly put. Dr. Sujata, would you like to add anything more here before we?
Yes, Dr. Rajam has, of course, thrown a lot of light on this, but I'd like to add that 24-hour helplines, free helplines, toll-free helplines, should be encouraged in every part of the country, in every part of the world, where a person can just pick up the phone and talk to somebody. Because isolation and loneliness is going to be the major concern in the months to come. And addressing the root anxieties, just somebody to hear the person out, that itself can be so therapeutic. So I think that is going to be, and as she said, that physical distancing does not mean emotional distancing. As long as somebody knows, every person knows that there is somebody for me, this is going to be the crux of the whole thing. So in addressing the trauma, addressing the core issues, that mental issues that each person who has suffered from COVID directly or indirectly, is going to be the crux of the treatment. So whether it is holistic health practitioners, whether it's family doctors, whether it is alternative therapists or psychiatrists, and as palliative care specialists, which Dr. Rajam is, they all need to focus on this, is that people right now are trying to reach you and you have to be available for them. And whether even doctors are as vulnerable as the common people. And they also need counseling. Very often we don't realize that as doctors, we are also going through our own traumas, our own insecurities. Every doctor also goes through this feeling, this uncertainty that what if I contracted the disease tomorrow? My family is going to be left forsaken. So they also need to be counseled. So 24-hour helplines are absolutely a must. So this is what I would definitely recommend first.
Absolutely, well said. I mean, you've spoken of how vulnerable even the frontline workers are. I mean, they are doing everything possible, and the kind of support they require too is absolutely relevant. Speaking of speaking of people who have suffered from, of course, the COVID symptoms, there have been several, there have been innumerable people gone, been admitted in hospitals, come back, having symptoms, still having symptoms, physical, I mean respiratory systems, I said respiratory symptoms. And we've read of people going on to YouTube, finding out what they should do and what really they can do as, tips to start feeling better, because there is, this quest for making themselves feel better, and it's just does not seem to happen. So how do we address these people who are typically who've been through COVID, the non-COVID chronic patients there were so many more in number who are also suffering? What do we do to these trailing physical symptoms, these respiratory symptoms that are there, that have been trailing all through? Dr. Rajam, I mean, I'm sure you're the best person to really answer here. I mean, especially with regard to the respiratory symptoms that have been trailed all along.
Sure. So now we know that we are 6 months into the beginning of the virus, and since March it's been declared a pandemic. So now we are seeing the after effects, and we are seeing, after following up patients who suffered the virus and who are recovering or recouping. So even now the statistics show that about 80% of patients still have mild illness, 14% have moderate to severe, and 5% need critical care. But we have seen that now we are seeing patients with lingering symptoms like post-viral asthenia, as we call it, which is severe fatigue, which leads to probably chronic fatigue syndrome, lot of muscle aches and pains, some patients who continue to feel breathless, and there are residual permanent scars, which we call it in lung. Now, I don't think we can do much to prevent these things, because this is something unpredictable of how the virus is going to live a course in a particular human being. But the importance of this talk is to identify that these things can linger for 3 to 6 months even after the illness. So it is important to be in touch with your doctors. It is important to maintain respiratory health in terms of exercise, immunity, pranayam, and build your stamina. At the same time, also get your lung function test done at an appropriate time, and keep in touch with the pulmonologist to see if there is any progress. So we are seeing residual fibrosis in patients affected by COVID-19, and we will only learn more and more as we see more and more patients surviving this illness. The other thing we have noticed, but of course in autopsies of patients who have died, are that patients are dying of clots, which is called as pulmonary embolism, which is one of the reasons for sudden deaths in these patients. So there are reports where patients walk in and give their history in the casualty and then suddenly collapse. This has been noticed in autopsies, and therefore now, as a preventive, a lot of patients have already been given blood thinners so that they don't have blood clots, which is one of the causes of sudden deaths. So chronic physical symptoms is noted in some patients. Hence, please, patients who are already affected by it, please be aware of this fact, and you really need to be in touch with your family doctor as well as and your pulmonologist. Also, patients who are affected can get reinfected. There is not known to have a lifelong immunity like any other coronavirus. Antibodies don't seem to linger for very long. So even patients who are infected by it need to continue maintaining everything to, for example, the mask, the hand hygiene, and the social physical distance. So it is important that you need to continue to do that even if you had the illness once.
Sure, sure. What about, I mean, if you, I'd like you to continue to about the non-COVID patients who have other chronic ailments. What about them?
So that actually, unfortunately, there have been many articles where they have said, where are all the heart attacks and strokes gone? Now, there's so much focus on treating COVID in various hospitals that even, and panic and fear, that patients are scared to go to the hospitals, and therefore the way we really need to address this is have dedicated non-COVID hospitals in the city so that patients know where to go. Currently, there's so much confusion about where dialysis patients need to go, where people with acute stroke, and there are many doctors who are not even practicing because of their age group or comorbidities or the fact that they have other responsibilities at home. So somewhere we need to now, even cancer patients who are not having surgeries or chemotherapy stalled because of the pandemic, we really need to refocus and regroup onto how we can separate COVID hospitals from non-COVID hospitals, because it is a very contagious disease, and patients with other chronic illnesses are highest risk factors for succumbing to the viruses. So we really need to see to that we separate this so that the care and the continuity of care for these patients do not stop. Because currently, all of them are going through a lot of distress and they're really clueless about where to reach out for help.
Absolutely. Very well said. Dr. Sujata, how does alternative therapy make such a difference to this entire gamut?
Right, Gayathri, that is a very, very good question, because being an alternative therapist, I'm a homeopath, and we have seen that once the patient is out of critical care, so they are in the hospital, in the ICU, they get discharged from there, they come home, and then that's the dead end. So then no more directions are given to them as to how they have to get themselves rehabilitated. What do we do? What do they do with the chronic lingering cough? It's not life-threatening because the doctor will ask, oh, how much is your SpO2, how much is your oxygen level? If your pulse is normal, you're not running a fever, then learn to live with this. It will go away. Try taking some cough suppressants. But it is still very distressing to the patient. So the residual cough is something that we have seen which stays with the COVID patient long after he gets negative, his swab comes negative. The other problem, as Dr. Rajam has already mentioned, is that the chronic fatigue. This can linger on for months together. Now, we have had patients who have come out of COVID in the months of, say, April or May, and still suffering from fatigue, still not feeling up to the mark. A lot of people have been complaining of brain fog, inability to concentrate, mental confusion. And this is a very, it's a well-defined symptom. It's not that they're imagining, oh, it will pass off. It needs to be addressed. And this is where a lot of alternative medicine can help. Homeopathy has been observed to be very useful even in the post-COVID conditions, especially the chronic coughs, the muscular aches and pains, the chronic fatigue, sometimes the headache which remains, the backache which may remain, and a lot of other issues, because now COVID is presenting in very, very different forms. Initially, it was only the respiratory symptoms, but now the new presentation of COVID is also the gastrointestinal presentation. A lot of people are coming with loose motions, with vomiting, nausea, anosmia, that is loss of smell was always there, one of the key symptoms of COVID presentation, but now loss of taste can remain for a long time. So people do not relish the food. So that is one more symptom that they come with. And because COVID is now negative, and because they don't have any life-threatening symptoms or very serious symptoms which need either antibiotics or any other treatment, multivitamins are not helping. This is where I think alternative medicine has a very big role to play. So it is not just about post-COVID, but even through the pandemic we have seen is that not to undermine the need for pharmacological intervention as and when the patient becomes critical, but we know that supportive care, basically isolation, oxygen support, nutritional support, and symptom management well in time have been the key factors in controlling COVID. So those who have done this at the onset are far more in a better position to deal with even the post-COVID aftermath than those who have not had this supportive care in the initial stages. So alternative medicine, I think, has a great role to play throughout, and there is no system that has been standalone in this whole thing. Everything has been through hypothesis, trial and error, and we did not run down any healing system. It is a time for collective integrated approach. which is going to be more, because now if you see, look at China. China has pumped almost $20 billion into their traditional and complementary medicine, and 90% of the population of those who have suffered from COVID have received this therapy. And they say they have documented evidence to prove that this has helped in faster recovery. So India, with its traditional systems like Ayurveda and homeopathy and Siddha and yoga, of course, can play a very, very pivotal role in establishing the fact that our mortality rate is definitely lower, probably because these systems have been in place. For every person that reaches the critical care unit of a hospital, perhaps these systems have helped in averting 10 of them, 10 hospital admissions. And more study needs to be done on this. It has to be corroborated, of course. But in our quest for evidence, in our quest for controlled and clinical trials, let's not undermine the efficacy of these systems, and they must be encouraged.
Very well spoken, Dr. Sujata. This takes me to another, concern that we've had, and in fact, we've spoken of psychosocial, we've spoken of physical, and which again comes up to the mental, the mental challenges that people have had. And when I'm saying mental challenges, I mean, right from the lockdown and the absolute breakdown of all activity with everyone at home, working from home, pretend to work from home, etc. That was one part of it. The other part with the untold suffering, unanticipated, unprecedented, the numbers that came in, the mental health of most of the observing populations, and of course of the suffering ones, has been, of course, there is no, let me say, I cannot even think of the statistics that can actually enumerate this. I mean, who has been the most vulnerable, and what would you want to actually speak about them, Dr. Rajam?
I think everybody has. It's affected everybody. I think the suffering has been like the suffering and grief has been, like you said, unprecedented, and it has touched everybody. In the sense, like I said, whether you're rich, poor, employed, unemployed, the loss of jobs, the loss of vocations for good. I mean, there are so many vocations which is just going to be a thing of the past. The lack of human interactions, the lack of a routine of getting out of the house and meeting colleagues, the over interaction with house people. There are some people with who face domestic abuse because they've never stayed in so much of close proximity with family members. And I think the fact that the absence of domestic help in certain families has really put the strain, and the gender bias that women are meant to do A and men are not meant to do, etc. It's all thrown, all this has come into sharp focus. So I think there's suffering across the board, which comes back to the point that we really need to be there for each other in some way, in some form, stay connected. And I think the whole ethos of palliative care is to address health-related suffering and to address not just the patient, but the patient and the family, and not just the physical symptoms, but everything. And it's extremely important, even more in situations like a pandemic, because there is a volume of patients affected. So it's not just, it's medical ethics, the legalities, and all these issues are also the moral decisions that doctors have to make with limited resources, and the overburdened casualty wards, intensive care, whom to treat, whom not to treat. All this is, there's a suffering across, and it's at this time it's probably not easiest being a doctor and listening to all the woes of human beings, because it is something that everybody is going through. And I mean, I can't even pinpoint one person who's not affected by this whole pandemic. And it is going to be like this. So it is, the sheer volume and proportion is going to be is staggering, and therefore we need to be there for each other.
Right. Okay. Yes, absolutely. My heart goes out to you when you say that. The amount of let's say experience that the past few months have given you doctors. I mean, it is yes, we know what it feels like to work from home, but you are there in the front line, and it is. I mean, your words are really heavy. Thank you for that, Dr. Sujata. How relevant is mental health and the addressing of it at this juncture?
Yes, Gayathri. In fact, I will take off a bit from what Dr. Rajam just said. She said that the kind of frustrations and the kind of depression that through because of all social psychological factors that are coming in, loss of jobs, lots of vocation, not able to go out, and lack of domestic help. So we are learning to be Atmanirbhar, self-reliant in more ways than one. But if and the gender bias is not so easy to shake off. So I'll take this opportunity because both my colleagues on this platform are women, and let me tell you is that as a society we still have to grapple with the fact that women, so whether they are professionals, whether they are doctors, they still have to take a major part of the burden of domestic work. And so it's not just about the well-to-do doctors, but there are healthcare workers, there are nurses, and there are social workers in the hospitals who are doing day and night duties, and they come home and they have to again deal with work on domestic front, and this is taking a big toll on their mental health. So as a society, we need to be aware of this fact that they need counseling, they need help, they need practical help. So I'm sure that we can have some helplines for them as well, some kind of cells which will reach out to them and help them in this endeavor, so to reduce a part of their burden. So this is one part, and both me and Rajam have been at both ends, so we know how it is. We just keep changing aprons from the hospital to home. The other aspect, I think, is the fear psychosis which is set in. And much as it is a pandemic or a plandemic, but it is also an infodemic, with the kind of misinformation that is going out, every single person becoming like going on Google and going on WhatsApp and social media and getting their own share of information and then trying to pass it on. Media has played a huge role, sometimes positive, largely negative, in spreading a lot of information which is not necessary and which has instilled a lot of fear into people. So when they say that you need to take this medicine, you need to take this kara, you need to take turmeric milk, turmeric water, so people are gulping it by tumblers and end up with oral ulcers and throat problems. So taking it to the extreme has also been a problem. So I think what is important is a balanced view which very, very responsible media can take and propagate the right amount of information to people. So this will reduce a large part of the stress and a large part of the mental issues that people are facing. So these are two very important things, apart from the things that Rajam has already highlighted. So these stopping the spreading of infodemic is very important, and then we can deal with the actual pandemic.
Okay, wow. Okay, it's a question in my head. I mean, we do think of mental health, and something that comes up in my head is the absolute, the youngest of us all, the senior citizens. I mean, there are several who live on their own. There are several who have always lived on their own and who don't want to really depend on their families. And yet, this is that trying time where they just can't be themselves anymore. Any thoughts here? Because mental health among them is, among this category especially, is something that is really worrisome. I mean, if you would tell them, go speak to a counselor or a psychiatrist, how ready would they be? Dr. Rajam?
So I think the senior citizen population, and I think we are going to be a grey country. The statistics show that by 2050, the number of 60-year-olds will grow by 300% and number of 80-year-olds will go by 700%. And we are not having that many people to look after them. So it is something that currently our population is young. So probably one of the aspects that we say we've not had so many COVID deaths, because in Europe, it was the elderly who died and the elderly who were not given active treatment. So I think that is going to be a difficult part for us to deal with. Having said that, I think in India still the social input in the sense of spiritually connected with prayers, chanting, the routine of lighting the lamp, or some particular festivals, etc., do keep these elders connected and socially upbeat. Having said that, it is something that we need to acknowledge. It is something which is there in people who are living alone, even if they have their spouses alive. Just the fact that they're physically not so independent can be very depressing. And therefore this needs to be addressed, and I think it is the next generation that needs to also focus on it. The family doctor plays an extremely important role in discussing this, and it's also noted that one of the signs of depression in elderly is weight loss. And so it could just be weight loss that's bothering the elderly, and that could be a clue for the family physician, for the children living abroad, that they really need to do something intervention. Having said that, I think it is also probably not such a bad deal to have gated communities or community living, as far as you're not uprooted from their neighborhood. Cities like Bombay and metros is probably difficult because of the real estate. I think that's where we need to think of the future, because I think the next generation cannot hold back its dreams only to look after, but there needs to be a fine balance. And I think so far we've still been doing it, but the pandemic has exposed that also, because of the fact that children are not able to reach their parents and parents are alone and lots of things, because elderly are more, the chances of them getting the virus and dying of it is more. They have been forced to stay indoors. So I think anybody being told to do what they want, nobody likes to be instructed, and not for 4 months straight in a row. So I think there's lots to be done with the elderly in the country, and I think it has to start, like charity begins at home. It has to be the family doctor, the children, and the fact that elderly can also get depressed. And the elderly, the mental health issues is very much there amongst elderly. So we really need to acknowledge that. And I think then start addressing it. I think the fact that we keep brushing it under the carpet, that it never can happen.
Absolutely, absolutely. Yes, Dr. Sujata. What is that?
Yes, that's a very, very relevant issue about the elderly. But Rajam and Gayathri, let me tell you is that I have been observing the elderly, and elderly form a large part of the alternative medicine treatment. They have done amazingly well. They've done surprisingly well. And I think a large part of that is probably because in India, the elders are still respected. Our social fabric is still strong. And by and large, by default, most of the people would take care of the elders, of the parents, much better than probably other family members. And because of the way they have learned to live life, they have dealt with it with more detachment, with more stoicism than probably the teenagers or the middle-aged people would do. I would say the most affected, physically and emotionally, would be the 50 to 65 age group, 50 to 60, 65. And maximum morbidity, maximum mortality has been with this group, because most of the comorbidities are with them, like hypertension and heart disease and diabetes, which have been the major factors. And also is that midlife crisis has hit them. They're suddenly probably without jobs. They're uncertain about their future, because they're at a stage when they can either go back and the future looks very uncertain and bleak. So that is the section that has been most hit. But the elderly overall have been, they have the issues, but they're not specifically related to COVID. This is what has been my personal observation. And of course, as Dr. Rajam says, that the other factors need to be taken care of. They should have gated communities. Care must be taken. The family doctor and the relatives must be taken into confidence and educated about how to take care of the elderly. But by and large, they have done exceedingly well in the past 4 months, especially in India.
Nice, and that's very nice to hear. I mean,
Yes.
that must come as comfort to many people who are listening to this conversation,
Yes.
Different from what is being talked about, being written about. This must must give some solace to them. We've spoken about physical, mental, psychosocial. Where are we now? I mean, yes, people have said that we should do this and we should make these changes, and this is how governance should be, and these are the kind of preventive measures that we should have, etc., etc. Okay, so yes, policy needs to change. In our earlier conversations, we have, of course, with both of you, we have discussed this in much detail, and it is important that the rest of us actually know of what you think here. Dr. Rajam, you have been speaking of advanced life care and planning for the near future for every one of us. I mean, that's something that you speak very strongly about. Please elaborate.
So I think that's the other thing that, like I mentioned in the beginning, the pandemic has thrown focus onto is the way we are dying and the fact that death will come to all of us. Somehow, as a society, we don't like to discuss death and dying. Medical training does not even encourage conversations on death and dying. Doctors are not trained how to talk about it or break bad news. I think it's high time this pandemic has actually thrown that in our faces, that we really need to discuss about how our loved ones, including ourselves, would like to be treated, especially at the end of life. Because of the rapidity in which patients have taken acutely ill, there hasn't been time to discuss that. So doctors have been thrown in this ethical, moral dilemma as to what to do. There is one ventilator, two patients. How do you choose which patient goes on the ventilator? And how, I mean, and who is right and who is wrong? And finally, it is, you know, the doctor also has to go home and have a good night's rest. So these things can be sorted. I think dying has been exposed in a very raw and crude manner. And the best way to do it is to plan, because just like you plan a financial will, and nobody bats an eyelid about planning a financial will. When it comes to a living will, it gets all emotional and people get all stuck. It is difficult, but not doing it is worse. If you leave a living will, if you leave an advanced care plan with your loved ones and your family doctor, at least people will not feel guilty. People know what to do towards end of life. People know you didn't want to go on a ventilator, or you didn't want to be resuscitated, or you didn't want to be in ICU. I think it's extremely important learning from the pandemic that we must start talking about death and dying to our loved ones, because death is inevitable. Bad death is avoidable. So we really need to focus on this and not say, shubh shubh bolo, if you talk about it, abhi humko kal aa jayega. It's important, because to be very honest with you, I'm sure most people who are on this joined with us today don't go on a holiday and rock up at the airport and station and say, okay, let me go to Delhi, or am I going to London? You plan. So who is planning the last journey of your life? It has to be you. It's your life. It's your right. It cannot be some alien in an ICU who's never even seen you, not even aligned with your values, beliefs, and what you actually want as a person. Nobody has the time to sit and ask you, Acha, what would you like? Is it tea, coffee, Hindustani music, jazz when you're dying? This is the only time you have. You don't have the time to come back and say, look, you didn't do this right, because you're gone forever. So it's important to plan the last journey of your life. And my earnest request to everybody is to start talking about it, start thinking about it, and also start documenting about it. I know legally in India, in March 2018, the Supreme Court has allowed the making of a living will. However, the logistical and the procedural logistics is not clear yet. Having said that, if you speak about it to your family and your family doctor, at least they know where you come from, and your wishes will be respected. And I think that's very, very important, especially in the last hours of living. You need to have a good quality of life till death, because the way in which a loved one passes remains in the memory of the loved ones. So if you're going to see suffering, pain, distress, it's going to be always there that I couldn't do that much for my loved one. So please, earnestly, advanced care will, there are websites, look at it on Google, living will, talk to your doctors. We really need to spread the word of people to write down what they would like and how they would like to be treated. Because unfortunately, India is amongst the 67th worst countries to die in, and in a quality of death index report by Lancet 2015. So there's so much that we can do, because our people who are dying suffering. And that's something as a society we really need to take cognizance of, because in our literature, in our philosophy, in Vedas, they have talked about allowing nature to take care. Let nature allow natural death. And somehow we treat death as a failure, and somehow we try and say that we need to do everything to conquer death. And I think somewhere we are being foolish. We need to accept that when things are not looking good, medical futility is something we should not be engaging in. In a country with limited resources, we rather give it to a younger patient who's going to survive and be productive in society than keep a 90-year-old alive, because we're not keeping him alive, we're just delaying his death. So it's very, very important to talk about advanced care plan. Plan your last journey. It is going to come to all of us. We are all going to be there one day. And it's better you do it when you're well, instead of saying, let me do it when I fall sick. Then your mental faculty might not be that great to decide. Start thinking and talking about it right now. Just as you celebrate birth, you need to start thinking and respect and celebrate death and the life of a human being.
Thank you, Dr. Rajan. That was a lot. Thank you for that. Dr. Sujata,
Yes.
how differently do you think about policy, about holistic care, and I mean, where is it that you bring in a difference here?
Yes, Gayathri, I think my take on this would be that policy now needs to be completely refurbished, because the remaining part of 2020 especially should be now about upgrading our healthcare system. We need to prioritize health very, very, especially in a country like India, where primary healthcare has been very, very severely neglected, with the results that there is so much of confusion today, putting so much burden on tertiary healthcare system. So that needs to be organized well, very, very well. We need to put our resources in the right place. We need to divert a lot of our funds now towards not just medical education, but paramedical education. So we realize that it's the nurses, it's the ward boys, it's the IRBs in the hospital, and the other healthcare workers who have played such a vital role in getting the patient back to recovery. Doctors, of course, are there, and medical education in India has been absolutely world class. That has not been the issue, but it is about paramedical health care which really needs to be upgraded. So today, while the doctors and the others have been doing an excellent job, but sometimes patients, when they reach the critical care units, they may not die of COVID, but they may die with COVID and of another infection, of a secondary bacterial infection, or maybe a fungal infection, which they didn't have in the first place. So all these things are hospitalized. The hospitals need to be upgraded. Healthcare needs to be severely looked into now. There should be a serious look into these matters. Also, I think we need to now look at sustainable healthcare, something which is affordable to everybody. There should be no discrepancy in primary healthcare being the right of every person. So today, while the rich and the bigwigs may have access to the big hospitals, within a couple of hours, the ICU beds are ready for them. There are people who are running from pillar to post, trying to get a hospital bed for their close ones. And precious time is lost in that process. So this really needs a very, very serious look, a serious thought, so that nobody is denied basic health. This is going to be the need of the hour, and this has to be absolutely addressed. So sustainable and affordable healthcare, prioritizing our health needs is important. Another thing I would like to very much stress on is there are two things. One is promoting and maintenance of wellness, so that you build your immunity from the start. And two is disease, addressing the disease. While modern healthcare and conventional medicine is excellent at the latter, but promoting wellness and maintaining wellness, definitely alternative medicine can play a huge role in that. So today when the pandemic is there all around us, COVID is all around us, and then you rush to do yoga, which you have not been ever accustomed to, it's not going to help to build your immunity for this pandemic. But if you start building your health resources from now, you start building your defenses from now, it will perhaps help you when the second wave comes. Hopefully it won't. Or if there is another epidemic or a pandemic, in a country like India, every year there is some epidemic or the other. Right. And it's only our innate immunity which is going to come to our help. So these are the things that I think policy makers must focus on in the coming time to come.
Okay. And you would also agree that these can be, of course, addressed by holistic alternative therapies that you've been talking about.
Yes.
Right?
Yes. As I said, that promotion and maintenance of wellness. And I said that even during the COVID pandemic, along with supportive care, with nutrition, hygiene, social distancing, masking, symptom management with Ayurvedic, with homeopathic medicines has played a pivotal role in keeping patients at home and home management. And this has actually, I think, definitely reduced the burden on our tertiary healthcare system. So a lot of patients who are otherwise also, we consider this as a self-limiting disease. But if you don't have adequate supportive care, you don't have adequate symptom control, that can set a patient to panic and he will rush to the hospital to get admitted. But family doctors, holistic healthcare practitioners can play a big role in this stage in controlling the pandemic.
Absolutely. We are going to be, thank you for that, Dr. Sujata. While we have spoken about, the living anew part of it, the mental, psychosocial, physical, and the policy aspects. I mean, of course, there are several more issues that we've yet to cover. We will not be able to pack all this in this 1 hour of conversation that we can have. It will have to wait for the next. At this point in time, before I move on to any further question, I'd like to take on some questions which have come in. There is Anand Bhatt who is asking, can homeopathy help in post-COVID depression?
Certainly, yes. As we just mentioned and we spoke about it a little while ago, is that this is going to be an issue that all of us are going to be grappling with, all the doctors, and because there is no structured treatment, there is no clarity on this subject as yet, because the uncertainty of this whole thing. It is a novel coronavirus, so we don't know how it's going to behave. Whether the mental issues, the psychological issues are a part of the COVID infection, or whether they are just a fallout of the peer psychosis that is set in associated with COVID, only time will tell. But this is where systems like homeopathy with Ayurveda and of course the other alternative systems can look into and provide a holistic approach, addressing the problem individually with the patient and giving remedies so that they come out of this problem without too much of pharmacological dependence. So providing counselors can give their counseling, and homeopaths and Ayurvedic doctors can give their holistic remedies to help patient come out of this depression phase. And there are several remedies in homeopathy, and we are kind of preparing, homeopaths all over the world are preparing themselves to face this problem, because homeopathy has been observed to be one of the frontline treatments for addressing anxiety neurosis, depressions, at a on a very global scale, even in the 1918 pandemic, and whether it was the Ebola virus and the H1N1 virus, homeopathy has played a huge role in symptom management as well as the post-infection fallout. So definitely we can have a collective approach and effort towards that.
Right, right. We have Geeta Masand who is asking, is it necessary to take vitamins, zinc, vitamin C, etc., because COVID seems to be again increasing? Dr. Rajam, would you want to comment on that, please?
So I think all these multivitamins, etc., are for your basic immunity. You need to have all these levels in the normal range. So if your ranges your levels are already, you need to supplement these. Second thing, just popping in these pills without any documented levels doesn't make any sense. Vitamin C, especially for people who have hyperactive airways or asthma, etc., does help. So you don't need to chew a tablet, but you can probably take your, the nimbu, the citrus fruits, etc., so that it's a much more interesting way of having these supplements. So I think the basic overall message is to be as healthy as possible and focus even on the trace elements. So a balanced diet, good, decent, moderate amount of exercise, sleep, as well as the fact that mentally you are also upbeat, because everything, it has to be a holistic approach. It's not enough only to pop these pills and then not get up from the couch at all. So it has to be a balanced approach, and just popping pills is not going to be enough. And don't do that if you do not have the idea of your blood limits.
Thank you for that. That is so relevant. Dr. Sujata, does vitamin C and D regular intake on a regular basis help combat COVID infections? Asked by Pushpa Salian. Pushpa Salian has asked you this question. What would you have to say?
Vitamin D and vitamin C are definitely helpful. They're the good vitamins, because vitamin C is known for its anti-infective properties, and people who have suffered from COVID and severe COVID-like symptoms have been associated with low levels of vitamin D. So vitamin D, anyway, the sunshine vitamin, as we say, is got from exposure to enough sun. But if you don't have that, and now in the past 4-5 months, practically people have been in lockdown, so exposure to sun has been very, very low. So even otherwise,
I believe she's, we cannot hear her. Dr. Rajam, are you able to hear me?
Yeah, I can hear you.
Yeah, well, we just probably got a little disconnected. I'm sure
Documented.
she'll be back.
Yes.
I'm sorry, Dr. Sujata, we couldn't hear you
You could
well.
not hear me. Okay, okay, I'm sorry. So shall I repeat the whole
Yes,
answer?
please.
So as I said, that vitamin D and vitamin C are the good vitamins, and deficiency of these vitamins can delay recovery. We know that. But unless we know, we have documented proof to show that you're suffering from any kind of deficiency, there's no point in popping in too much of vitamin either, because you can then suffer from something called as hypervitaminosis. So you should take it in adequate proportion. And also natural sources are definitely more welcome and more palatable and better absorbed as compared to the synthetic vitamins. So if you can have a piece of pavla every day, that is definitely more, it would actually take care of your entire vitamin C levels needs through the day. So lots of citrus fruits, enough water, watery fruits like watermelon and muskmelon and oranges, and a lime every day, and a bit of amla if you can manage. I think that should take care of your vitamin C needs through the day.
Right. Thank you. Dr. Rajam, here's a question for you. What's your take on all systems working together for faster, smooth resolution of infected persons? Asks Jaya Pai.
So I want some clarity on what is all systems working. Is it the systems of the body or the systems in the public? Can you please clarify, Jaya? Because I can take that other question in the meantime while she clarifies, which is what care should be taken in quarantine or post-COVID hospital discharge. So I think a lot of, you can do a lot during the post-COVID or quarantine. First is, of course, mental health. Hopefully there's no stigma around you for being COVID positive or your family member being tested COVID positive. Please continue to be careful, hand hygiene, mask, avoid crowded places, etc. The third thing is, of course, because if you've been bedridden for a long time, slow, gradual physiotherapy, very, very important. A balanced meal. If your physiotherapist cannot come to your house, there are lots of online things. Do not do something on your own with YouTube. At least refer to one physiotherapist for one session before you can continue to do things on your own. Also, the person who is quarantined from family members who are COVID positive, you should check for signs of becoming COVID positive yourself. So I think it is probably a good idea to have a handy pulse oximeter at home, but also not get over obsessed with the oxygen levels like some of my patients do. Everything in moderation works well. I think anything in excess gets to you emotionally and psychologically. So it is important. Having said that, it is easier said than done. I can understand that there's a lot of panic and fear. So get to your right resources, get your information from reliable resources, and please do not believe in the university of WhatsApp. It's a dangerous trend. Best to stay away from it. Get to your doctor communities, get to the right. Even we are learning, to be honest with you. The pandemic is teaching us also. So we are in this together. So there is everything that you need to do as a responsible citizen of this society. You need to continue to do it when you're have suffered it or you're in quarantine.
Absolutely. Thank you for that. Jaya Pai has clarified that it's systems of treatment that she is trying to say. I'm just repeating that question. What's your take on all systems of treatment working together for faster, smooth resolution of infected persons?
So I think she means by different streams of medicine like allopathy, Ayurveda, etc. So again, I just have to put a note of caution saying we don't have any evidence. We are too early in this pandemic. 4 to 6 months is not enough research. But yes, like Dr. Sujata said, there is a role for all holistic medicines and alternative treatments as well, like homeopathy, like Ayurveda. But I cannot vouch and say that there is evidence and this is what it is. This is the statistical significance. So everybody, like I said, we are all learning in this together, and including the medications. You can see how countries have jumped from steroids to HCQS to remdesivir to multiple things. So we are all trying. We are all trying to grapple with this present situation. So we need to be, it's very difficult to point fingers that this works and this doesn't. I think what definitely works is to stay safe, smart, and also use all the necessary things to prevent this infection till as much as you can. But it is going to affect all of us one day or the other. It's like I said, it's here to stay.
Absolutely. Thank you, Dr. Rajam. Dr. Sujata, Akshat asks, can homeopathy be taken along with allopathy meds for corona treatment?
I think Dr. Rajam just answered that question. And as a homeopathic practitioner, I can say that we can definitely reach a convergent treatment where allopathy has its role in aggressive disease, addressing the disease very aggressively, especially in critical care. But when it is mild to moderate, mild bordering on moderate, definitely homeopathy has a very big role to play. And just pumping the patient with antibiotics is of no use, because this is more of it's a viral infection, and antibiotics are mainly given to prevent secondary infection. So this is where if you start homeopathy at the onset of symptoms, you can actually help control the symptoms. So symptom management being the key. And of course, overall, there's a holistic feeling of wellness when you take homeopathy. And if you can actually help the patient not take too many antibiotics, so you're actually preventing antimicrobial resistance. So in a way, it's a multi-pronged approach. And at the same time, you must take homeopathy or Ayurveda from a trained clinician who is working in tandem with either the family doctor or the critical care specialist.
Right.
It should be done in convergence. It should be done together, so that the end result is about patient getting better as soon as possible. And this can definitely work together.
Okay, okay. I'm going to a question that has been asked. I think both people have asked the same question. Mr. Gune and Ria have asked something similar. They have asked about the importance of HCQ and arsenic album as preventive. Who would like to take this on, the question between the two of you?
So
Dr. Rajam
I can try that. So see, about HCQS, I think it is very clearly documented that it should not be taken prophylactically for people sitting at home. It has worked well with doctors who are exposed to COVID-19, working in COVID-19 wards. It has been protective for them. So I do not advise a blanket that the whole country should take HCQS.
Okay.
It's for people who are exposed to. So for example, police people or the sanitation workers, doctors who are constantly exposed in COVID wards, it has shown a protective effect. Other than that, no. Arsenic is of course Sujata's forte, so I give it over to her.
Yes, so thanks Dr. Rajam. And arsenic album has been one of the remedies that has been found in clinical trials, and it has been found to be effective in all the epidemics so far. It has been one of the drugs that has come up very often as a preventive as well as in treatment protocols in homeopathy. Now, somebody could ask me this, that homeopathy being an individualistic science, we focus on the individual symptoms. So how can you give one remedy as a blanket prophylaxis to so many people? Let me tell you that arsenic album is one of the polycrest by, let's put it in common language, as a broad spectrum remedy. And because of its sphere of action on the respiratory tract, the alimentary tract, and every possible mucous membrane of the body, it can help not only in prevention but through the treatment of the COVID patient. And it has been administered in in large scale, on a large scale in India, all over the country. And wherever it has been administered well in time, we have found that the rate of people getting COVID infection has come down. And those who have got COVID have tested positive also. It has helped in earlier symptom control. So, of course, we need to extrapolate these findings on a larger scale, and it's only after the epidemic is over that these things will actually be called as evidence-based protocols. But first, do no harm, and homeopathy does no harm, and it has been a very, very safe and hopefully a very effective prophylaxis against COVID. And it has been called the immune booster, and very well so, because a lot of our patients have truly benefited from this. We are conducting a lot of observational trials on this.
Right, right. Thank you for that. There is Trupti Naik Matapati who is asking, due to staying indoors for 4 months, my vitamin D levels have dipped down, have a lot of muscular pain. The doctor has put her on vitamin D pills. What can be done? What else can be done?
So I did write to her. I said exercise. You know, some part of the house can get some sunlight now in the monsoon. Sit there for 20 minutes with 2/3 of you, lifting your dress above the knee and sleeves above your arm, and sit in the sun for 20 minutes. Then you can take vitamin D supplements depending on how low it is. So you must consult your family doctor, as well as calcium rich food. So ragi, milk, cheese, those kind of things. But it is important to supplement vitamin D, because now there's enough research to suggest that vitamin D helps you maintain your immunity and also prevent certain chronic life diseases like heart diseases and unfortunately in a country like India, being a tropical country, we still have a pandemic of vitamin D deficiency, even before this pandemic. So it's not just the pandemic to blame. We've had this problem for a long time because of sunscreen, or we don't step out between 9 and 4 or use an umbrella because the sun is so strong.
Exactly.
So we really need to focus on that. It's been an issue even before this pandemic.
Absolutely. Totally agree. Dr. Sujata, do you want to add to that, please?
Oh, that is very true. Again, as Trupti was asking, even with, there have been cases where even with taking vitamin D supplements and trying to follow all these, there are still people who suffer from chronic vitamin D deficiency. And this is where homeopathy can certainly help, because it can help your vitamin D to get absorbed better. It's a constitutional treatment where we actually focus on why this is happening. We focus on the reason behind your low vitamin D levels. And stress is a very, very major factor in reducing absorption of the essential vitamins into the system. And homeopathy addresses this very well. And we've seen that even with when we give the constitutional dose, the patient responds to the supplements much better. So if there's a deficiency, you have to supplement it with the necessary treatment. But sometimes when there is a lack of absorption, homeopathy can definitely play a mediator or a catalyst role there and help your vitamins to get absorbed better. So if you have an essential issue, you can certainly contact your homeopath.
Thank you for that. Thank you. Before we move on to it's 7:22, and I know that we had told ourselves that we are not going to stretch beyond an hour, and we have. Before I wind up, I'd like to ask you one last question, both of you. We need to have a takeaway from both of you. So, Dr. Rajam, what is your takeaway? What do you want people to go home with?
I think my biggest take-home message would be try not to panic and listen to too much news. Try and maintain a balanced lifestyle even if you're home, and please start talking to your loved ones about death and dying and thinking about writing a living will, because it is extremely important to you, your family and the healthcare professionals. You will do us a huge favor by staying safe, staying indoors and having a plan.
Thank you. Dr. Sujata.
Yes, my take-home message for everybody would be is that COVID is here to stay. We have to now learn to live with it. And it has been a big revelation, a big eye-opener for us. So things like hand hygiene, masking, avoiding crowds should have been implemented when COVID was not there. Unfortunately, it took a virus, a microorganism to teach us this lesson. So let us now live with this lesson. Let us follow this even once the pandemic is over. We continue with these precautionary measures. You must understand that holistic health is the key to immunity. Start building it now. So start doing a yoga now. Start following lifestyle measures, adequate sleep, good nutrition, good relationships. Very, very important for mental and physical health. So these are the factors that are going to play a key role in your immunity against future epidemics, or as I said, the second wave, God forbid there is one. So these are important things. Having said that, I would like to end on a very positive note. Positive is the new negative. So on a very optimistic note, let me say. And that is, this COVID has done something very good for us. And that is the emergence of the family, the restructuring of the family. We have realized the importance of the family. Initially, it was we were forced to stay together. But I think now people have realized that family values, core family bonding is so important when it comes to dealing with an enemy like this, over which we have no control. Even the best humans have absolutely no control over this. So this is probably nature's way of now making us realize that these are core values which we have given up. We need to follow them again. So stay home, stay safe, where you can remain unmasked. Pun absolutely unintended.
Thank you for that. That was totally unintended and very well put. Thank you all.
Thank you very much.
It has been a pleasure talking to all of you, and we will wait to talk again. Thank you, Dr. Rajam. Thank you, Dr. Sujata. It's been a pleasure. Thank you to the team of Dr. Sujata Naik's clinic, because they have been so sweet in planning the logistics and making sure that this is live across all forms of social media and of course through the Zoom Connect. Thank you very much for organizing this. The details of both our speakers will be relayed to you through this communication, of course. You can be in touch with them via email whenever you wish to. Please stay tuned for more. We will be back with a lot more. Thank you all. Thank you for watching. It's been a pleasure. This is
Thank you for the
Gayathri.
chance.
Thank you,
Good evening.
Gayathri. Thank
Take
you,
care.
Rajam. It has been wonderful. Thank you very much.
Good evening.
Thank you. Thanks, everyone. Have a lovely evening. Bye.
Right. Bye-bye.